Hi, I'm Dr. Aimé and I'm a plastic surgeon located in Scottsdale, Arizona. And today we're going to be talking about breast implant sizing. So here we have 5 smooth, round silicone breast implants. And even though they probably look different, they are actually all the same size. Now how can that be? Well, every breast implant has 3 factors that go into sizing. And the first one of those things is called the base width, or the diameter. If we look at the bottom of the implant, it's really just the width of it. The second factor is called the projection, or the height of the implant, and how far out it's going to sit on your chest wall. And the third factor is the volume. So as we talked about, all 5 of these implants have the exact same volume. So think about a thin glass holding a certain amount of volume versus a short, wide glass holding the same amount of volume. So in reference, this is a thin, tall glass, and this would be a short, wide glass with the same exact volume in them. When it comes to your unique body, the one factor of these 3 that we don't have any control over is the base width. That's actually determined by your chest anatomy, but the other 2 we can choose. And so just for reference, about 150 cc's is equivalent to 1 cup size. These implants here are about 385 cc's. So when we start looking at these, we'll start at this one down here. This is a low profile implant, very thin, tall, and it looks kind of like a pancake. So it will sit very high on the chest wall and give you upper pole fullness, but for most women, this wouldn't work because it would touch their arm when they're doing certain activities like playing pickleball, going for a run, playing tennis, or swinging a golf club. So for a lot of women, that's not a great option. As we start to move up the line, you have implants that have higher projection and a smaller base width. So you can kind of see that difference here. The more moderate or full projected implants are more commonly used. They give a nice natural appearance. When they're sitting on the chest wall, they look like a teardrop. And as you can see, they're very different than a low profile implant. And the last one we have here, this is a higher, extra high profile, and this is going to give you the most shelfy or augmented look. So it's got a very narrow base and a very high projection. So this is for a patient that has a very narrow chest wall or really wants a very augmented look. So when choosing your implant size, just remember these 3 factors. So your base width of your implant is really dictated by your chest wall anatomy, and that's something we can't really change. But it is important to think about what kind of a look you would like in terms of projection and how much volume you would like, because those are 2 factors we can pick when choosing your implant size. If you'd like to see me as a patient, feel free to give us a call or go online to our website. You can also schedule online if you'd like.